In this video, we're going to answer the question is what is a disc herniation? Hi, my name is Dr. Andrew Gurecki, back pain specialist, physical therapist, and I'm here to shed some light on the question of what is a disc herniation. We're going to use this really nice Essential Anatomy app to describe this on our Mr. Skeleton guy here. I have had a disc herniation before. L4, L5 was my level, so I can relate to this. So if we take this anatomy guy here and we zoom in, we're going to use the lower back as an example of a disc. But you can see here, as we look at the spine, every vertebrae in the spine, these are our lumbar vertebrae, has a disc in between those bones, right? And that disc is really a connective tissue. It is really like in somebody who's 25 years old, it's like crab meat. It's a very soft, moist, pliable material. As we get older, it feels more like a leather belt. And you can see I've got this L4, L5 disc highlighted in green here. And when this herniates, what ends up happening is that the crab meat material that's on the inside of this squeezes out the side of the disc. And you can see here the problem with that, if I put the nerves in play here and I zoom in, you can see that there's a nerve that comes out of each level of the spine. It looks very messy here, but you can see this is what's called a nerve root, right? This is the L4 nerve root. And you can see here how close that is to the disc, and it comes out of this little hole in here. And when the disc material, again, we zoom out and look at the disc material here, when that squirts out to the side, little crab meat pieces will herniate or bulge out to the side, and it takes up space in this little hole. And the problem with that is there's a big nerve right there, and that nerve travels all the way down. You can see that each one of the levels of the spine, the nerves come down here, and right behind the butt area, they turn into one big fat nerve called the sciatic nerve, right? So if you have a disc herniation, you can see this. If we just travel all the way down the leg, that big sciatic nerve goes all the way down to the toes, the back of the thigh, goes to the big toe. And again, if there's pressure on that nerve, here we are again in our disc, L4, L5 disc, that nerve gets pushed on when the disc herniates, and it pushes on that, and then we get the physical compression of that nerve causes pain, numbness and tingling, traveling down the legs, and in worst case scenario is weakness. Now, the good news is that that disc can heal. It can heal without surgery. And we'll talk about that in another video, but I just wanted to give you a quick description of what a disc herniation is so that you can visualize that, and hopefully that helps you understand a little bit more about your body.